high schoolers are ditching the vapes. That's according to a new CDC study. Just 10% of high schoolers report using vapes. That's down from 14% last year. But the same can't be said for the younger group of kids. The study showed that middle school students reported a rise in overall tobacco use, reaching more than 6% in 2023. The results show that there is still a lot more work to do to curb the appeal of flavored nicotine among kids. So for more on this, I want to bring in Dr. Debra Houry. She is the Chief Medical Officer from the CDC. Doctor, thanks so much for joining us. My pleasure. So high schoolers are using less tobacco products. Why is that? And why are middle school kids taking to it? It would strike me that if you decide to start smoking, oftentimes with children, it starts because there's somebody that you think is cool, either a parent or a public figure that is smoking. That is the appeal. So why are middle school kids using it?
So, a few things about this, and I think, as a mom of a young high school student, this certainly worries me overall. Even though we have seen a decrease in high school students, it's still 10% of high school students that smoked in the past 30 days, and about 2.8 million overall middle school and high schoolers. You're right. We have seen an increase in middle school kids. It's still less than the high school kids overall. And for me, it's a trend. We need to see what happens over the next year or two. When you look at what's being marketed to kids, though, it's things like, flavors that are really marketed towards kids, like cotton candy or bubble gum. And that's really concerning as a parent and doctor and as a public health professional. This is being marketed towards our kids, and that's why we're seeing that there's more interest in kids in things like e-cigarettes.
So I have a couple of questions, and I think people should understand when we talk about tobacco products, we are talking about vaping and regular cigarettes, the old-timey cigarettes, I guess, all kind of lumped together. You talked about these products being marketed towards kids. I thought there was this sort of big hullabaloo about vaping products and the flavors and the CDC cracking down on flavors and the marketing. Is that still happening, that we have vaping products that are being marketed towards kids?
So the FDA is working on regulations around a lot of these new products, but you can still find them on the market, and you can still see them to where they might be in reach of kids, to where kids can see them. And what I would say is this is why it's so important to talk to your kid, or if you're a doctor, to talk to your pediatric patient, because parents might talk to their kids about cigarettes, but may not talk about things like e-cigarettes or vaping, and that's all part of it. And when you think about the impact on the developing brain and nicotine dependence, we have to make sure that we're having these conversations with our kids.
So you talked about the fact that they may still be within reach, or some of the marketing may still seemingly target kids. So are you saying that these brands aren't following the rules?
So FDA is who's in charge of really enforcing these regulations, and many of these companies have to apply, share data, and there's different standards. So some of these products can still be available. Others may be newer products, or also being, developed. So what I would say is, for me, it's just about the overall focus on e-cigarettes, cigarettes, and making sure that our kids are safe. We know that those products are out there, and we also know that for kids, they're going to look to their peers, they're going to look to their parents, they're going to look to their doctors. So the more that we can address all those different fronts on why it's important, including they're young and they have a developing brain, and we want them to be successful and thrive in adulthood. And if they're using nicotine-containing products, it's going to impact their developing brain.
And can we talk a little bit about those vaping products and the fact that the nicotine that's in them, or the delivery process, makes it much more addictive than even a regular cigarette, and which makes it super concerning when we're talking about a middle schooler. If adults find it hard to break the habit, I can't imagine how hard it is for a kid.
So a few things about that, and one is this study showed that if you use these products a few times a month, you are likely to show some signs of nicotine dependence. So you might think just a couple times a month is not too many, but it is too many if your body is already starting to get dependent on it. And we also know that if you are using nicotine products as a youth, you are more likely to have long-term nicotine addiction and may become addicted to other drugs as well.
So the question is, what can parents and teachers do to help?
One, talk to your kids. Make sure that they are aware that just because something, sounds fun or flavorful doesn't mean that it's safe or okay, that it's still just as dangerous as other products. And there's a 1-800-QUIT-NOW tip line, that you can refer your kid to. And we also are working with pediatricians through the American Academy of Pediatricians to help them learn how to screen their patients for it. And then educators are so important as well. We have an Empower Vape-Free Youth campaign that helps educators with how to talk with their students about it. Most important thing is have those conversations at home with your kids.
All right, Dr. Debra Houry, thank you very much.
My pleasure. Have a great morning.
You too.